So this is a MIDAS, Arc Northwest Coast MIDAS seminar session, which Gill and Kenny have very kindly offered to present on qualitative systematic reviews or approaches to, I'll read the title, Approaches to Synthesis, Methods for Qualitative Systematic Reviews. It's very kind of both Gill and Kenny, who are from UCLan, to present this. And the aim is that it's going to be for around about an hour. I'm not quite sure how long you'll be speaking for, and then the opportunity for questions at the end of the session. Just to remind everyone that it is being currently being recorded. Okay, so over to you, Gill and Kenny.
Thanks, Andy.
Yes, thanks, Andy. As you can see, my name is Dr. Kenny Finlayson. Professor Gill Thompson is also on the line. We both work at the University of Central Lancashire. We're both based in midwifery research. I should add that a lot of the examples that we're going to give in this session will be from midwifery. So I'm not going to apologise for that, but obviously that's just our area of expertise. So what we're going to look at is the approaches to synthesis methods for qualitative systematic reviews or qualitative synthesis. So I'll tell you a little bit about the different terminology that's used. But basically, I'm going to discuss a method of synthesis called thematic synthesis, which is at the more descriptive end of the synthesis spectrum. And then Gill's going to talk a little bit about meta-ethnography, which is more at the interpretive end. So I'm just going to start the first few slides just to give you a little bit of a background to qualitative synthesis and the overall methodology.
Just to say, Kenny, it's not full screen, the slides.
Okay, sorry. Let me just...
I don't know if you do F. You haven't got F5 anymore, have we, on the keyboard? Used to be able to just...
Yeah.
Either the bottom, you know, the bottom with those little icons.
Yeah. I'm so used to doing it at the top. Which is it?
I know we need some techie help. Go on, Becca, you're on. Do you know? You youngster. Oh yeah, perfect. That looks great.
Okay, sorry about that. So I'm going to just sort of talk about the definition of what we mean by qualitative synthesis and some of the terminology that's used. Because it's a relatively new method or methodology, there's a lot of different terminology out there. But essentially, we can define a qualitative synthesis as the bringing together of findings on a chosen theme, the results of which should, in conceptual terms, be greater than the sum of the parts. And I guess that's the key part of a qualitative synthesis, that it should be greater than the sum of the parts. The different terminology for the methodological approaches, you quite often see it written as qualitative evidence synthesis. This is a Cochrane term, and as you'd expect with Cochrane, the emphasis is on evidence here. So qualitative evidence synthesis is a broad methodological approach which involves quite a lot of robust methods within that approach. Qualitative metasynthesis is perhaps a more well-known term. It's been established for quite a long time, and this perhaps refers to more of the interpretive type of synthesis. Meta comes from Greek and means going beyond, so that gives you a clue there. And qualitative systematic review is more in a line with the sort of methods that we use in quantitative systematic reviews. So detailed and transparent literature searches and formal analysis and a defined synthesis method would all encompass a qualitative systematic review. But these are just broad terms for the different methodologies. So just to illustrate exactly what we mean, given that I am a qualitative researcher, it's quite nice to have a little bit of a sidetrack into a visual representation. So if we think of qualitative synthesis as this idea of going beyond the sum of the parts, so you can see at the back, this is a parable about blind men feeling an elephant. So the man at the back there is holding the tail, and he says it's a bit like a rope. The one in the middle there is feeling the body of the animal, and he said it's very tough and it feels a bit like a wall. The one next to him is feeling a leg and describes it as like the trunk of a tree, and so on and so on. But it's only when you pull together all those different experiences that you get to what an elephant actually is. So why do we synthesize qualitative research? Well, we can establish greater understandings or transferability in the findings of qualitative research. If you have a lot of different qualitative studies from around the country or even around the world on the same or a similar topic, then you can enhance the understanding in that particular area. Oops. You can also identify gaps or areas for further exploration. So, for example, in a qualitative synthesis that we recently conducted for the WHO, we found lots of studies from Europe and North America and Australia, but very few from Latin America and Africa. So that was a gap in the knowledge in a global sense, that there wasn't representation. In this case, it was to do with experiences of antenatal care from those particular continents. We can use it to develop or expand theory, and that's sort of more at the interpretive end of synthesis, and Gill will tell you a little bit more about how that's done using meta-ethnography. And we can also use qualitative synthesis to inform policy or guidelines, and I guess Gill and I have been involved mostly in that area of research. We've both been working with the WHO, looking to inform their guidelines in maternity care. Now, there are some differing opinions about whether we should even do qualitative synthesis. So you'll see on the left there a quote from Margaret Sandalowski, who's one of the pioneers in this area. And she says that to summarize qualitative findings is to destroy the integrity of the individual projects on which such summaries are based, to thin out the desired thickness of particulars, and ultimately to lose the vitality, viscerality, and viscerism of the human experiences represented in the original studies. So she's basically saying that by synthesizing qualitative studies, you're taking away that original context and that original understanding for that particular group of people at that particular time. And in that way, you lose some of the meaning. However, the counter argument to that, and this is one that probably Gill and I both agree with, is that if we don't synthesize qualitative research, then it risks further marginalization from policy and practice, because it then remains isolationist and esoteric. So you might have lots of different relatively small qualitative studies from around the country or from around the world on women's experiences of stillbirth. But if you just leave them with 6 or 7 participants in each study in different contexts, then they sort of get pushed aside and not used in an evidence sense. Whereas if you pull them together, then you have a much greater body of data that you can then draw conclusions from, and in our case, help to inform policy and practice around stillbirth. Now, as I alluded to at the beginning, within these broader methodological approaches, so qualitative systematic reviews, qualitative evidence synthesis, there are different levels of synthesis, so different methods of synthesis, if you like. And there's a sort of continuum, but there are 2 broad ends. So one is the aggregative or descriptive level, and the types of synthesis that we're talking about there would be thematic synthesis, which I'm going to talk about as we go on, narrative synthesis, framework synthesis, and these are sort of more additive or summing together or aggregating existing findings from qualitative research to produce themes, and it's much more of a deductive process. Whereas at the other end of the synthesis spectrum, there are these interpretive or configuring types of synthesis. The main one, apologies, for some reason the slides have moved on. And they're not allowing me to go back.
And it's disappeared.
I don't know what's happened there.
That was just saying though, isn't it? I mean, I can talk more about the kind of reconfiguring level anyway, which is giving some examples, wasn't it? Like the critical realist or the meta-ethnography, which is the one we're going to talk about in a bit more depth.
Yeah, I'm just going to see if I can reload.
It's oh, it's like it's just gone.
Yeah. Can you see that?
Yeah, but it was still on an earlier slide. So if you moved out,
Yeah,
but we can see them.
Okay,
Yeah.
Let me just see if I can pick that up again. No.
How strange.
I might have to just leave it on the...
Yeah.
On this level, because I think you can see that, can you?
Yes.
Yeah.
Okay. So yeah, I was just talking about the interpretive and configuring level. So meta-ethnography, realist synthesis, critical interpretive synthesis, these are all involve a much higher degree of interpretation of the findings. So developing concepts, and theories to expand or explain the evidence, and it's a much more inductive approach. If we look at the overall steps to producing a qualitative synthesis, and this applies to both the descriptive types of syntheses, but also the interpretive syntheses, there are 6 key steps, I guess, for synthesizing. First of all, there's the suitability of the research topic. So is the topic original? Is it appropriate for synthesis? And there is a database that some of you may be familiar with called Prospero, where protocols for metasynthesis are often published prior to the topic being explored. But obviously you can do searches as well, just to make sure that the particular question that you're looking to address hasn't been answered, or if it has been answered, was it a long time ago, and therefore a synthesis, a more current synthesis might be appropriate. Secondly, there's the research question, and in order to frame your research question, there's different strategies that you can use. PICO is the quantitative approach. PEO is the one that we tend to use for qualitative synthesis. So that is, P stands for population, E exposure, and O is outcome. So for example, if I was interested in women's experiences of antenatal care, then the population would be women or pregnant women. The outcome would be experiences, and in qualitative research, there's usually some element of experience. And the outcome, the experience is antenatal care, and the outcome is experiences. So the search strategy, if you're doing a qualitative evidence synthesis, then this is a fairly comprehensive search of lots of different databases. You would need to set inclusion and exclusion criteria, decide where to search, if you're going to put limiters on the search, and all the kind of things that you would usually adopt if you were doing a systematic literature search. Now, assessment of included papers. Some qualitative researchers would argue that you don't need to use a quality appraisal tool because that sort of defeats the purpose of a qualitative study. But Gill and I think both come from the perspective that there needs to be some element of quality appraisal. There are a number of tools out there, including CASP, which is most commonly used. We tend to use a tool that's been developed by Sue Down at the University of Central Lancashire, which amalgamates a lot of different quality appraisal tools. The synthesis, which we're going to explore in more detail, so the actual method that you want to use. We've talked about thematic synthesis. Gill's going to talk about meta-ethnography. So you need to decide which would be the most appropriate method for the type of synthesis that you want to do, and the aim of the synthesis. Then finally, how you want to express those findings. So most of us would look towards producing a publication, a paper from the synthesis, but it may well be that you're working for an organization that would like a report. And being qualitative researchers, there are other ways of producing or expressing the findings. So for example, I was in Sweden a number of years ago, and a social scientist had done some research into the experiences of textile workers in Sweden and had produced a meta-synthesis, but they'd expressed it in the form of a tapestry to fit in line with textile workers. So it was a very powerful representation, but obviously it was aimed at a particular audience. And if your tapestry skills aren't particularly good, then it's probably not a good idea. So moving on to a particular type or particular method of synthesis. So this is called thematic synthesis. It was developed by Jane Thomas and Angela Harden in London. They're based at the Social Science Institute. So in terms of the different steps, they talk about the research question as being used to assess the appropriateness of an intervention. And a lot of thematic synthesis have taken a sort of barrier and facilitator approach. So what are the barriers and facilitators to patients performing exercise with chronic kidney disease is one that I was involved with. But it can also be used to address feasibility and acceptability issues relating to the intervention. So is it feasible to implement from a patient perspective, and is it acceptable from a patient perspective? And of course, within that, there's going to be some element of patient experience. The search strategy that Thompson and Harden recommend is fairly extensive. It goes beyond databases. So they suggest hand searching relevant journals. They also suggest looking at book chapters and reports, since a lot of qualitative data is published in reports. In terms of quality appraisal, they have a fairly comprehensive tool that assesses methods, ethics, reliability, credibility, and appropriateness of the studies that they're including in their synthesis. In terms of the analysis, they use line-by-line coding of results, of the results section of the included studies. So some approaches to synthesis would suggest that you look beyond the results and findings sections, but Thomas and Harden are very clear that that should be where you focus your attention. They also use a software that they have a one that they recommend, which is called EPI software, but you can use, excuse me, Envivo, or Gill sometimes is used something called MaxQDA, and that's basically to organize your data, and it helps with coding data to particular quotes from participants and things like that. In terms of the actual synthesis, Thomas and Harden suggest that you group codes, so codes with similar ideas or concepts, into broad descriptive themes, and then they have some level of interpretation, because those descriptive themes are then interpreted into more abstract analytical themes. So in most studies, you'll get maybe somewhere between 12 and 20 descriptive themes, and then that narrows down once you interpret those into more compact analytical themes, down to somewhere between 3 and 8 analytical themes. So apologies for the small text here, but this is just to give you an idea of how we do the coding of data. So On the far left there, you'll see that the author title of the papers that we're including in the synthesis, the date it was published, followed by the country it was published in. In this case, it was a global review looking at what matters to women in the postnatal period. And then all the different colours represent different codes from the included papers. They're then colour-coded into broad themes, which then become the descriptive themes, like this. And the descriptive themes there are written across the top. So you can see for this particular synthesis, parents expressed, number one there, overwhelming feelings of joy and love for the new baby. And they also talked about coping with periods of low mood, depression and loneliness. They talked about the anxiety and fear associated with the new responsibilities of looking after a baby. And then dealing with feelings of acute fatigue and exhaustion, which I'm sure most parents would relate to. So those are the codes then become these descriptive themes. Oh, don't know why this has disappeared, but sorry, so then the descriptive themes feed into the analytical themes. So the analytical themes are listed down the left there, and they're sort of more interpretive. So those 4 descriptive themes that we saw in the previous slide, value feelings of joy and love for the new baby, coping with periods of low mood, depression and loneliness, etc., become that analytical theme, which we titled Riding the Emotional Rapids, because most of those descriptive themes were around the emotional aspects of being a parent. And then we had 4 other analytical themes there, which you can see on the left. Now, I'm just going to, for the last few slides, talk about a tool called CERQUAL. CERQUAL stands for the Confidence in the Evidence from Reviews of Qualitative Research. So if you're looking to feed some of the findings from your synthesis into policy or into potentially guideline recommendations, or if the funder is looking for some practical use for the qualitative data, then CERQUAL is a tool that helps policymakers, guideline panels decide on which are the most important findings, or which findings you can have the most confidence in. And this stems from GRADE, which is an organization that assesses quantitative data in a similar manner, but with GRADE you're looking for certainty in the findings. With CERQUAL, because we can't be certain about qualitative research, we're looking for confidence in the findings. So there are 4 components to CERQUAL. The first one is methodological limitations, then coherence, adequacy and relevance. And in theory, they sort of relate to the GRADE criteria that are used in assessing quantitative studies in terms of risk of bias, inconsistency, imprecision and indirectness. So I'm just going to go through each of these briefly. So if we look at that Thomas and Harden example, we had a number of descriptive themes, including parents feeling exhausted and tired, for example. So for that particular finding, then we would assess the methodological limitations of the studies that contribute to the finding, and look for the extent to which there are problems in the design or conduct of the primary study supporting a review finding. So for that, we would look at the quality assessment that we'd have done on the individual studies and assess whether the methodological limitations were major or minor or relatively unimportant. Coherence is the second component, and this looks at how clear and cogent the fit is between the data from the primary studies and the review finding. So we might be less confident that the finding reflects the phenomena of interest when some of the data contradict the finding or when they're ambiguous. So for example, if we're looking at women's expectations of labour, in that particular synthesis we found fear of childbirth as a review finding. But this finding was largely reviewed to women who were giving birth for the first time. So the coherence in that finding, fear of childbirth, was downgraded because it didn't apply to all women. Adequacy of data refers to the richness and quantity of data supporting the finding. So we might be less confident that the finding reflects the phenomena of interest when the data underlying a review finding are not sufficiently rich or only come from a small number of studies or participants. So in this component, we're looking for the richness of the data supporting the finding. So you may only have 4 or 5 studies, but if the data is particularly rich and comes from a lot of participants within those studies, then you would say that the adequacy is quite strong. However, if you only have a couple of studies and the finding that you're referring to is only mentioned in passing or briefly, then we would downgrade adequacy of data. And finally, relevance reflects the extent to which the body of evidence from the primary studies is applicable to the context specified in the review question. So we might be less confident when the context of the primary studies are substantially different from the context of the review question. So an example of that might be if you're looking at African women's experiences of giving birth in public hospitals in Africa, supposing some of the studies that contribute to that finding are not from African women, or they're from private hospitals rather than public hospitals, then you would downgrade on relevance because it's not the context that you're specifically looking for in your review question. So once you've been through all those different components, you can then give a confidence grading. So if, as a consequence of looking at all those components, you feel confident that the finding does reflect the question that you're looking to explore, you would grade it as high. And then there are moderate, low, and very low, depending on your assessment. So just to give you an example of how that would look, and going back to the descriptive themes that we identified as part of the postnatal, what matters to women in the postnatal period, you can see there at the top on the left-hand side, the finding was coping with periods of low mood, depression, and loneliness. There's a little summary of that review finding underneath. The next column along is the studies that contribute to that finding. In this case, there were 11 studies. Then we have a brief summary of each of the methodological component, the circle components rather. So methodological limitations, adequacy of data, coherence, relevance, and then on the basis of those components, the overall circle assessment, which in this case was moderate, and the 2 findings below that on the left-hand side, anxiety and fear about new responsibility, and coping with feelings of acute fatigue and exhaustion, were also graded as moderate. So that's CirQual. And just to finish off, so thematic synthesis is an iterative process. It requires input from a small team with qualitative research experience. So this isn't something that you should do on your own because there are lots of discussions about which papers to include, about the quality assessments, about CirQual grading, and it's important that it's more than one person to limit bias. From thematic synthesis, we can generate descriptive themes, which we can then use CirQual to apply CirQual to those themes, and then use those to inform policymaking or guideline recommendations, or any other instance where somebody is looking for a practical application from these findings. And thematic synthesis is one of several synthesis approaches advocated by Cochrane, by the Cochrane Qualitative and Implementation Methods Group. So if you were thinking of doing a qualitative evidence synthesis as per Cochrane style, then thematic synthesis is a form of synthesis that they would recommend. So apologies for slides missing and dropping in and out, but I'm going to pass over to Gill now, who's going to talk about another approach to synthesis, metaethnography, which is kind of more at the interpretive end of this overall methodological approach. Thanks,
Kenny. Should we try again, putting it full screen, see if it, and just let everyone just bear with us in case it just goes messed up again.
Oh, sorry, Gill, it just seems to...
Oh, is it just jammed? It's just jammed up. Okay. Oh, strange, isn't it? Yeah, sorry, Kenny, go back.
Yeah.
It's just like frustrating, isn't it? Technology. Saying that about technology, though, I know there's been some comments about NVivo, but I must say, you know, Matt's QDA is just a beautiful system. I need to buy shares in it because I just recommend it and get people to buy it all the time. It's just a wonderful, intuitive, qualitative, you know, data software program. And just saying that those slides before, gosh, these slides have gone messed up again, Kenny, haven't they? This looks weird. Do you want to stop sharing and see if I can share? Maybe try my slides, see if that.
Yeah, okay.
Do that, because it's just all horrible. But saying that work that Kenny showed with the Excel, so I have done a descriptive that nearly breaks me, I must say, with all the color coding. Just so I don't know. Matt's QDA is kind of, yeah, the way to go for me. And always happy to talk a bit to people about it and share the system. Okay, so try this. Yep, does that look okay?
Yeah.
Great. Okay, so yeah, I'm just going to talk through, probably not for too long, and then we've got some time at the end for some questions about the metaethnography. I must say, I really like this approach. I've used it numerous times and worked with students using it. And as Kenny was saying, it's a more interpretive, configurative. And it is, because it's, you know, I sometimes hear this, even with Kenny, thinking that it can be kind of a muchness, some of these. But metaethnography is quite distinct, I think, than other approaches that I'll talk about. So this work originated with a book, a nice thin book as well. So I read it a long time ago with my PhD by Noblet and Hare, so published first in 1988. And I think, if this is Kenny can correct me, I'm pretty sure they wanted to combine ethnographic studies looking at desegregation in the education system in America? Or something like that. Yeah. But anyway, but it was all right, good. Yeah, but it was very they were combining ethnographies. Was actually what's happened since then is that we use it to combine different qualitative approaches. And you can see, so they have 5 key steps. So, and as you can see, they didn't do any detail about how we find the literature. It was much more about what we do with it once we've got it. So often when we do these studies, we do say it's a systematic review and metaethnographic methods. So we make sure there is that combination of both. So following all the stages that Kenny talked about before, and then this is more the analysis. So as the stages, obviously, you know, really important, let's read them, you know, don't forget to do that. We determine the key issues. Translation, so saying this is a really key difference about metaethnography than others, how we translate this information into one another, reciprocally, refutationally, and creating a line of argument synthesis, and then how we express it. And I'll talk through more about these in the later slides. And it's very different in terms of thinking about the data. So they talk about having this first order, second order, and third order constructs. So the first order are the quotes, the participant quotes. When we're reading a paper, we can see them. Obviously, they're very evident. And so they talk about this being this everyday ways of making sense of our world. So the second order are the researchers' interpretations of this common sense world. So expressed through concepts, theories, themes, metaphors. And then third order is what we do with it as reviewers. So if we're doing a systematic review, is our interpretations of the researchers' interpretations. And in meta-ethnography, because this is really important and kind of what work with students, we're working at this second order level. So we're just working on the authors, how they've interpreted the findings, and also what they talk about within the discussion. So I actually remember, well, this a couple of years ago, having a conversation with somebody who's developed the guidance about this, which I'll show you in a minute, and saying, why don't we use the quotes? Because sometimes you're reading a paper and you might see a quote and think, oh, I don't think they've interpreted that. That's an additional point that could be really useful to talk about. But actually, you know, the authors understand that whole data set when they've interpreted it. And if we just took that single quote to mean something additional to what they talk about, we could be overtly biasing what we're presenting. So this is why we don't. We do use the quotes to help illuminate our third order constructs. And again, I'll show you an example of that in a minute. So this is really important. We just look at their work. So this is just an example here. This is from a real paper. So as we can see at the top, when it says universal benefits of access to this service, this is the author interpretation. That's what we want to focus on and pull out what the key issues, themes, metaphors that you're using. So as I've highlighted to the right, so if we're just summarising that text there, what we're highlighting is the antenatal checks provide reassurance and that women value socialising. So in a sense, we'd ignore the quote. Well, we can select the quote. If we think, oh, that's a great quote, I might just select that, put it to one side and look at whether I use it when we come to doing our interpretation. So again, then comes to the next text here where it says the women who are classified as high risk, etc. So again, on the right, pulling out what that issue's talking about. So about high risk women, considering antenatal checks invaluable to get the care they need. And then again, we've got another quote, it's the same thing. We might put it to one side and keep it. And again, go into the next body of text and pulling out the key issues. So all this then on the right becomes really the second order constructs that we then combine and collapse into themes and sub-themes, very similar to what Kenny produced. But it's just very explicit about what the data that we're working with to do so. So saying before about this levels of translation, so it can be reciprocal, reputational, or we build a whole story, this line of argument, but not necessarily all three in the same review. It just depends what data there is. And it's quite similar to this constant comparison where we get findings and we compare and contrast across this whole corpus of data that we have. So obviously reputation, the reciprocals, obviously, they're all saying the same thing. And we did a review where we were looking at the ways in which parents can feel emotionally close to their babies when they're admitted to neonatal care. And actually all we found was all about strategies that parents use. So it wasn't going to be reputational because it's all the multitude of ways in which parents could do this. So we knew from the beginning it was only ever going to be a reciprocal level of analysis. But sometimes and often you don't know what you're going to find until you have all that data together. And in terms of line of argument, saying before, this becomes this overarching synthesis. And actually it's only more meaningful to do this if you've got a whole body of literature. So for instance, one of the students we worked with recently, we could only find 5 qualitative papers to include in a review. So what we produced is a bit of a hybrid. We did a tentative synthesis because there wasn't an awful lot of data in the area. So to try and argue something more definitive wouldn't have been appropriate. And again, it's jumping around, isn't it? So yeah, so this is really what we do. So all these blocks here are meant to be our different papers, and we pull out elements so we can look at relationships in the concept across studies. but also within the studies. So we pull out all this second order data, then compare, combine, translate it. So what you can also do with metaethnography, it might be that you've got a really good primary paper that's really rich conceptually, and you use that the starting point to help you manage the data set. So for example, we've got our quality study A. So we pull out all the Keams metaphor themes from the second order into a framework and then use that to map on the other studies. So it starts off very inductively and then can build up with more, and then use it more deductively. But obviously, if there's new issues that come out within quality study B or C, we add those to the framework. Or, you know, if we haven't got a paper like that, just start with the first one, start coding and then building up the coding framework as you work through. So there's something that's come about with the guidance, and in fact I'll share some of the literature, because they started looking into this a few years ago about how people are doing metaethnographies, and there's some great titles, this metaethnography madness that was going on, and people saying it was a metaethnography when actually it wasn't. And again, because it wasn't demonstrating these translational elements. So this is kind of a table that's produced by Britt and Attell in their metaethnography. So this is looking at, I think, medication adherence. So you can see at the top, they've got some more kind of characteristics of the tables, but down here, they've got some of the themes. So they've got adherence, compliance, self-regulation, aversion, so alternative coping, sanctions, and then the issues that were pulled out across all the papers. So it's really, you need to be very explicit when doing this approach to illustrate this, you know, where's this data and how is it mapping? So I did something a bit different in one we've just had published, the one I was saying about parents' emotional closeness. So on the left here are all the papers, and then here I've mapped them to all the themes and sub-themes that we created. So again, really clearly demonstrating which papers are contributing to what. And again, another example, so this is one we had published with one of our master's students. So we were looking at women's experiences of birth trauma. So again, here on the left are all the second order constructs that we found across the papers, then how they were kind of being merged into themes. And all these numbers here are the references. So these all linked in the reference list. So again, this clear transparency about where this data is being found. And this is kind of what it looks like when we write up. So this is from the emotional closeness one. So we have all these kind of concepts and then linking all the literature to them. So we can see here with all the numbers, and then often blending in this first order. So all of this kind of in the text is this amalgamation and synthesis of second order, and then using some of the first order to illuminate. So you can see here, like I've added in some fragments of quotes. The baby getting to know me better, and then some standalone quotes as well. So just in terms of the refutational, so what's different? So as detailed here, it's really looking at things that can counter, you know, any metaphor, themes, concepts that oppose or refute, you know, refute emerging patterns. So for example, in Garside's work, this is women with heavy menstrual bleeding, and found that women were influenced by the same external sources, but actually they had very different effects for them, that they could either encourage or discourage an acceptance of their situation. And in the metaethnography I did with the student, we found that the role of breastfeeding was really different across the papers. So for some women, breastfeeding, you know, following birth trauma was really healing. It was a chance that they got more confidence in their bodies. It helped them to bond with their babies. But in other, you know, experiences, that they actually saw it as another violation, you know, that they found breastfeeding kind of took them back into the birth, you know, triggered flashbacks and these nightmares and, yeah, intrusive thoughts and images. And that women could find it really hard to breastfeed when they didn't have a bond with the baby. So this approach of really getting to look at, you know, are they saying similar things, or where they refute and how? and making sure that we represent that when we present the whole. And coming on to the whole, so saying before about this line of argument, so this overarching synthesis, or as Noblet and Hare say, what can we say about the whole? And there's different ways in which you can do a line of argument. So for example, we did on this one is text-based. So we just wrote a very clear short paragraph that summarized, I think it was about 16 different papers that we'd included, lots of different themes and sub-themes that came together in this one tight paragraph. So I'll just give you a moment so you can just read it. Okay, so it does, I would say it does take some crafting. Obviously starts off huge and then whittle it down to actually just, yeah, make it as tight and representative as possible. But another way for kind of this, you know, this conceptualization of the whole can be through a model. So this is one by Daka White about patient safety in primary care. So they presented it like pictorially. So kind of the key elements that were important from a patient, a system and staff perspective, as well as some of the kind of barriers or points that can barriers to patient safety, sorry. So you can see here some of the neglecting of personal life that they represent down here. So there's, just different ways in which we can use this information. And Noblet and Hare do talk about the importance of tailoring outputs to the intended audience, you know, and so academics can be more interested in the methodology, practitioners much more about the clinical practical of this work, and policy, the extent to which findings are transferable. But I think it's kind of a bit of a grey space to me, like Kenny talks about the circle before. And again, it's something I've gone back to people who are working on developing metaethnography about whether we should use CIRCOR with metaethnography or not. And I think it's because once you start moving away, or the further you move away from individual, we think it becomes harder to say about these confidence within the findings, because we are, once we've done the interpretation, we're on this third constructs about how we have interpreted it. So it's, still a bit of a grey area what we do with this. And me and Kenny talk about it intermittently about whether we should or whether we shouldn't. So we're saying before that the, metaethnography has gone through this big kind of revamp recently because of this work, this meta-synthesis madness, looking at what's wrong with metaethnography reporting and evaluating the systems. So there's been a number of different publications in this area, and it ties in with here the eMERGE guidance. So they've done an awful lot of in-depth work, and I've got down here this paper by France et al. About reporting guidance, which is really invaluable. But actually, if you're going to do a metaethnography, these key elements that you need to think about and how you need to present this in your work. So I think, as Kenny says, we use this a lot anyway, doing quality reviews, very iterative. And the fact, that we are reinterpreting, reconfiguring, it isn't final and it is contingent based on who's doing it. So recognizing this, a different team could look at that data set and present it in a different way. I think it is always challenging representing all the views, bringing them together, and saying before, creating a line of argument. It does take a lot of crafting to get this tight and cohesive. Moving from descriptive to interpretive as well, what we kind of keep and how far we move away can be depending on who's in the team, which brings into different reviewers. And I know Kenny was saying before about having a small team, but actually I've led metaethnographies with some big teams, and it is challenging, different viewpoints. And I think, as I feel, when it starts to come more to the analytical, you're much better having a smaller number then. So getting the larger team to help with the screening and bringing, with the inclusion criteria, doing quality appraisal, but getting to that analytical process, it's kind of much better with a few smaller number. And I think something that we probably don't do as well, that we should do perhaps better, is because we are combining different theoretical and methodological approaches in metaethnography. You know, they'll often have phenomenology and grounded theories and case studies and ethnographies, and not always as much consideration about how the data is being collected as I think, yeah, we should do. But again, I think that's something that is evolving and developing within this work, which leads me nicely onto this quote here. So this is one by Thorne et al. In 2004, but definitely still, yeah, still important and continuing now. That this quality metasynthesis is unfolding before our eyes as we dive deeper and deeper into its implications and applications. And I think, you know, for us with the Cochrane, seeing that they are doing qualitative reviews and there is much more focus and value on qualitative research is pleasing for us, as myself and Kenny being really fundamentally qualitative researchers. And that's it. Thank you.
Thank you, both Gill and Kenny. That was for a quantitative researcher like myself, that was very very intriguing as to what the similarities probably are and differences between the different approaches. We all sort of face the same sorts of problems, just in sort of different ways around it, and it's obviously developing. But I should hand over to anyone who has any questions that they'd like to ask Gill and Kenny at all.
Yeah, hi there. Thank you for the wonderful presentation. I learned a lot. Thank you very much for that. What I kind of my perception of what I saw during the presentation is that there is kind of a need to have some kind of creative writing, how to interpret what is written, and to give it another to stay true to the meaning of that interpretation, but also use other words that bring that interpretation to life. And so you need some kind of creative writing and some kind of thinking a lot to make sure that you stay true to what was said in the original paper. And so how do you juggle that to not move away from the meaning that this person gave in their interpretation in the paper?
Yeah, that's a really good point. How do we do that, Kenny? How do we even do that? I think it's a lot of practice and learning and reading. And I think once you know, when you're doing these types of reviews, you've got to hold an awful lot of information in your head, you know, and actually, like, we're doing another one at the moment. So you're always a bit grateful when you can only find less than 20. You're like, hooray. You know, one of them was 34. But I would say it was the one with the parental emotional closeness. In some of the papers, there was only bits of fragments. You know, there was a couple of papers that was just about emotional closeness. So I think the amount of data definitely comes into play. But I think you're right. And I think when you're doing interpretive, which is what I love with lots of the qualitative research, it takes you to wider reading. So you don't just, I think descriptive, you'll stay much more within the findings. Was actually the interpreter will start making you look elsewhere. Like, for example, I've done quite a bit of work with shame, and I did this within, I know it was a primary work, but it would apply similarly. If you started hearing lots of elements of that, I would then go to the shame literature and start reading more broadly, so you could help that, then bring that concept more to life. And certainly then obviously talk about that more within the discussion, that draw on that more wider theory. Does that kind of help? Make sense? Yeah, thank you.
Thank you very much. Thank you.
I don't know if you wanted to add to that, Kenny, as well.
No, not really. I think it's a skill, and it just takes a bit of practice. But certainly for a thematic synthesis at the descriptive end, it's a bit easier to make that creative leap.
But you do see, this is, I mean, just maybe me and you having a bit of a debate there, because it is, you do descriptive and then go analytical, which, you know, then it's coming up there, isn't it? It's kind of like a hybrid, because you could just, and really the descriptive is what you do the circle on, and then we can do the nice stuff, which we like is more interpretive and analytical, can't we? So it seems more hybridy than just, yeah, aggregative with that lovely coloured Excel, which I have done and cried over a few times. Oh, and integrative, yeah, we do integrative, and definitely we do. How much we could cover in this session. I do a number of these for students. I think they're really important to do, to get that comprehensive overview. And, you know, and again, I think it is more flexible looking at different methodologies that use that, about how you work with that data. So yeah, we're doing one about kind of peer support with late in trauma. So actually it feels we want to get this overarching sense as to what's been done, how, when, why. So yeah, definitely. And I think, you know, it comes back to your questions as well. What actually do you want to know from this review? I don't know if somebody was putting comments in the chat as well. There actually give some insight to publishing in journals, reviewer comments, but to understand. Yeah, Circle, have you? Oh, there's quite a lot here from Lisa. I mean, there's a few here for you, Kenny. We've definitely used Circle. Do you want to talk about that, where we've used it within policy? Because that's the World Health stuff that you've done a lot of, Kenny.
Yeah, so yeah, we use Circle. It's mainly being used to inform policy and guidelines, because I guess a lot of people who sit on panels don't have such a lot of experience with qualitative research. So to have something like Circle that just says, yes, you can have confidence in this finding, this one might not be so appropriate, then it really helps them to make those decisions. But also more and more, we're finding that Circle is being used in regular metasyntheses that are published in journals. The website, I'd encourage you to look at. The Circle website. It's a great website with lots of information and resources on it.
I think, you know, you're saying, sorry, I've just realised, Beth, you asked something else. I think definitely, you know, I think with this, we're doing an integrative using that approach, and certainly the thematic one that Kenny said. I think, yeah, definitely you could use that in an integrative, just argue as to why it's the right approach. But I think, you know, lots of this, because when you're doing integrative, you do it narratively. So even though there is descriptive data, the quant data, you do blend it narratively. So I think you could definitely use Thomas and Harden for that. Lisa, you've talked about publishing. You know, we say about, do we have any problems about publishing? No, and you know, the last two, one I've led on and one I was like second on, no, they absolutely fine. I don't think I've ever had a problem really publishing. No, I think it depends on your journals. And I think, again, you know, qualitative research has got much more kudos these days. And it's about showing, isn't it? I think whatever you do this work is showing how you've done it and having that kind of confidence in the findings, you know. So like when I was showing that example before, for me, I'd want to see all those links, the publications to the concepts, you know, so it's really clear when you're reading it that it's absolutely grounded in the work. But yeah, so I don't know. Have you had any problems, Kenny, publishing?
No, I've never had any problems. I was just writing something to Lisa because I think she's got to go at 11.
Right,
just
okay.
Saying, I'd be less inclined about using Circle in an interpretive review, because I don't think that's been fully thought out yet. So okay. Circle is predominantly used in kind of descriptive type reviews, or that end, just because it's much easier to apply when you're talking about interpreting and reinterpreting that Gill was talking about. Then having confidence in those findings is much more difficult because you're much further away from the original data.
We did, I did do a paper that we did both. So I talked about the descriptive, probably like you have, I'm sure as well, Kenny. So I said, here's the descriptive, because it was work for the World Health, and here's Circle, and now I'm going to present the interpretive. So I put everything in one paper, because actually what I wanted to do was do something more comparative, because it was looking at pharmacological and non-pharmacological pain relief. So I wanted to look at it in a different way for the paper. So, you know, and again, I think you can do that as long as you justify it and make it really clear what you've done and why.
Victor's got his hand up, I think. To ask
right, great. Sorry, can't see.
Hi.
Hi there.
Hi. Mine is a bit specific question. I think I could say to Ken and you as well. During your start or looking for the information research, did you specify I've just heard mentioning of the African ethnic group. Did you specify the asylum seekers and refugees specifically because of lack of aspects? Say if some are not being allowed to have what you call medical because of the status immigration they're using today. We could say what to call they name it what call Western environment.
Sorry, I'm really sorry. So this is about what, including their voices or the difficulties they face, or do you mean having if you've got a specific review on a certain population? Sorry, I don't know what they.
Yeah, my question was that is there any possible, or did you specify a targeted group of like asylum seekers or refugees?
Oh, I see. Yeah. Oh no, definitely. You could definitely do that. If you absolutely, that if you want to do a review and I only want to look at that population, definitely. We do it sometimes. We're only going to look in these low and middle income countries. We're only going to look for people who have that specific population. We're only going to absolutely, and some ways, sometimes you have to do that to manage the data set. Same before, doing qualitative, you do not want loads. Integrative, you know, more descriptives, easier, but certainly interpretive, you do not want those. So sometimes we'll say to students, look at ways to reduce to get a really focused, you know, angle on what you want to look at. So you could definitely say, I just want to look at asylum seekers, refugees, any literature in that context. That's my review. Does that answer your question?
Yes, yes, it does. It does.
All right, good. Thank you.
Does anyone else have any other questions they'd like to ask Gill and Kenny? If not, we can round up because it's just gone after 11 o'clock now. And I'm once again thank both Gill and Kenny for what has been a really useful presentation, which I hope everyone's found very useful as well. There's a recording of it, which will be available at a later date. I think one of the things that's come out of it is some issues around the software that different people use, with different recommendations coming up. So we might follow up with another session around that for people in the future. So once again, thank you both, and thank you for everyone for attending. And I guess we'll close the session now. Thank you.
Thanks everyone. Thanks Andy.
Thank you. Bye.
Thanks. Bye.
Bye.